Welcome to another episode here on Focus Gold TV where we inspire minds and shape the future. And in today's episode, we are going to be talking about occupational health and hazard, occupational health and safety, rather. And in our studio today to help us do this discussion is Dr. Abdul Moise Tikuma Mukhtar, PhD. He is an environmental health specialist and a lecturer at the School of Public Health, University for Development Studies. And my name is Muniru Baria. Once again, please like, comment, and share our content so it reach wider range of people to also benefit from this. And like I said earlier, we're going to be discussing occupational health and safety. Basically, we'll get to know some of the safety and safety practices that will ensure the welfare and safety of people who are engaged in work or employment. Doc, welcome today.
Thank you very much.
Great. Um, Someone may be asking what occupational health and safety is. What is it and why is it important in our workplaces?
All right, thank you very much. As you indicated, I'm with the School of Public Health at UDS, and the department is Department of Environmental and Occupational Health. So we teach both bachelor degree in environmental health, and we also have a bachelor's degree in occupational health and safety in our department. Now, to your question, occupational health and safety uh, it means things that you do to protect and to ensure the health and safety of people in work settings. The WHO defines health as not just merely the absence of disease, but it includes the physical, the chemical, the social, and the mental being of people. So when we look at occupational health, we try to ensure the physical, the social, and the mental health and well-being of people in work settings. So, all right.
Now, what are some of the common workplace hazards? We have different workplaces, but probably there are some common hazards that run through all workplaces. What are some of them, if you can tell us?
All right. So, uh, occupational health is very, very important uh, for us to be interested in because there are hazards or there exist hazards in our workplaces that are likely to endanger the health and safety of people who work in these work settings. There are a lot of hazards at the workplace, as I mentioned. They include physical hazards, chemical hazards, and even social hazards, things that we don't even think are hazardous. They are hazardous to us at the workplace. For instance, if we want to look at the social hazards at the workplace that can influence the health and safety of our workers, it includes harassment at the workplace.
Okay.
Harassment. I'm a teacher, assuming when I go to school or anytime I go to school to teach, there's a particular student who harasses me.
Okay.
It can affect your mental health. And in a day, if you want to go to school, you'll be thinking, "Hey, so today I'm going to school to be harassed again by this person." That's a health issue we are looking at in that sense. Physical hazards will include factors of the environment of the workplace. If your workplace produces a lot of noise, that's a noise hazard. If the noise levels goes beyond the threshold set by law or the levels that can cause damage to your hearing, then that's a physical hazard that can be detrimental to your work at the workplace. If you were in your house, you wouldn't have been exposed to that hazard at the workplace. So that's what we call the workplace hazard. Depending on the industry or the workplace we are looking at too, it could be chemical hazards, production places or production sites, pharmaceutical companies and all that. they use a lot of chemicals in their productions, and workers are the first line of exposure in case of any leakages or other substances getting into contact with the human system. So these are all factors of the workplace environment that could be hazardous to the human health.
Let me just divert a bit with the example you cited about a lecturer being harassed. Someone may be asking, how can a lecturer be harassed? Because usually the harassment is from the upper hand to the lower hand, or the higher authority to the subordinates. But how are lecturers or even senior staff also being harassed by their subordinates?
You'll be shocked. Harassment can happen anywhere, and it can be from bottom up or top down approach. When I was teaching at a certain school some years back, a student boy was harassing a female teacher. Somebody the students used to call Mama. In that school, students call, they see us as their parents. So especially the female teachers, the students were calling them Mama.
Yeah.
The student who was calling a teacher Mama had the guts to harass he was sending her text messages and calls and trying to lure her to be, is it, I don't know whether it's woman friend or girlfriend.
Interesting.
Yes, it came up and we had to summon the students
No.
to caution the student to stop that. It can happen in all ways, whether from student to lecturer or from lecturer to student. The system is now very sophisticated, and the caliber of students we have today are not like some of us when we were in school. We used to fear our teachers a lot.
Yes.
Things have changed. Things have changed.
Now, are there some occupations or some workplaces that are mostly of higher risk of occupational hazards?
Yes, there are some workplaces that would present higher hazards. And so if the hazards are more and more vigorous, they will lead to more injurious situations. For instance, in places of production where they use a lot of chemicals, and sometimes places where they use extreme temperatures in their production or in their workplace, they would present higher risk than places that they don't use a lot of. For instance, in the mining sector, the hazards there are more. In the oil and gas sector, the hazards there are more vigorous and more dangerous than in places like in education, in a classroom. The hazards there will be less. So it depends on the situation. In the electrical fields too, because of the higher voltages and currents that they use, the hazards there will be more. So precautions will be more vigorous than in other settings.
Now, let's look at the hazards. How does it affect workers or employees?
So exposure to hazards could, depending on the type of hazards you are exposed to, it can lead to diseases. And some hazards can also lead to injuries and accidents. Now, if you are exposed to whether diseases or injuries or accidents, mentally you would be unstable. So we usually say that we have two effects of hazards at the workplace on the worker.
Okay.
One is direct effects, and then we have indirect effects.
Okay.
And mind you, the effects of hazard is not only on the employee, the worker.
Okay.
There are also some effects on the employment,
Okay.
the employer, the workplace. They also have their share of the effects.
No.
For instance, some of the direct effects of occupational health on the worker is the suffering the person will go through if there's an accident. The second is income, loss of income. The person will have to use money to treat himself. Then the person is likely to lose their job depending on the gravity of the injury or the accident. The person may even lose their life as a result of the accident or the injury. So those are direct effects. The indirect effects on the employee, that's the worker, are effects on their immediate family. If he was a breadwinner, now he has stopped working, how would he cater for his family? So those are indirect effects on the worker.
But in an instance where let me use the indirect, that a person loses his life or is incapable of taking care of the family, I'm sure the organizations are supposed to compensate the worker or the family.
Yes, that's under normal circumstances, and that's why I was saying that the employer also has a share of the effects, and one of the direct effects of occupational health on the employer is compensation.
Okay.
And we would only talk about compensation if there is an occupational health and safety system running in that organization.
Very important.
If there is no policy on occupational health at the workplace and you fall down from a height and break your leg, there is no incumbent on the employer to take care of you.
Mm. Before we get to the regulations, because I'm sure there are supposed to be organizations that should regulate some of these things at workplaces. What are some of the basic measures that people can take at their workplace to protect or prevent themselves from some of these common hazards?
So for the worker, education is very important. You have to be aware of the hazards at the workplace and try to, because the first line of defense is yourself. You don't wait for people to care for you, for your health. You should care for yourself first. So the responsibility for prevention lies on you.
The individual.
If you are engaged in a particular work act in your workplace that you think is injurious to your health, it is your right and responsibility to run away from that act or to draw your employer's attention to the fact that this thing that I'm doing is not going to help me or it's not helping me, and demand your employer to come in to address the issues that are bothering you. So the first line is you. But the basic thing we should put in place to ensure occupational health and safety, or that the health and safety of workers are in place, is to put in place a system at every workplace that will be in charge of ensuring the health and safety of workers.
Now let's look at the use of personal protective equipment. How important is it? I know sometimes some of them are very uncomfortable, so people prefer to work without them. But how important is it?
Yes, PPEs or personal protective equipment are part of the measures put in place to ensure that we guard the health and the safety of workers. So if you identify hazards at the workplace that could affect workers, you would have to look for how you can prevent the worker from getting exposed to the hazard. And one is using PPEs. If there are maybe hazards in the air, then you can recommend nose masks. If the hazards are going to affect your eyes, then you wear goggles or whatever can protect your eyes. If it's on your head, we have safety helmets. Then we have uniforms that you should wear to help protect. So PPEs are meant to protect workers from hazards of their environment. And they are very important, and it's the responsibility of both the worker and the employer to ensure that PPE rules are observed.
Now let's come to training on the safety and also how to educate and prevent workplace hazards. Whose responsibility is it? because there are organizations when they just employ you, they give you the equipment, they don't monitor and then train you on how to use them and probably educate you on why you should use them, why it is important for you to use them.
Okay, thank you. So we have what we call principles of occupational health and safety. One of the principles is identification of the hazard.
Okay.
And if you are not educated, you will not be able to identify the hazards. That's why at UDS we are training professionals in occupational health and safety, so that if you employ them in your workplace, it will be their role, their responsibility to identify hazards in their workplace and to draw your attention to those hazards and possibly to help you to prevent those hazards from you getting exposed. So education is very, very important, and you need a specialist in the area to educate both the worker and the employer. Because sometimes the employer is not actually doing his part because he's not also aware. He has no education on
Yes.
hazards at the workplace, so we can't really blame the employer too. He may be ignorant of the hazards at the workplace, not to talk of protecting his workers from those hazards.
Now, do we have institutions that are responsible for regulating and enforcing occupational health safety regulations?
So the institutions responsible for, in Ghana, for instance, the Ministry of Labor
Okay.
is mandated to protect, to ensure the protection of workers' health and their safety at their workplaces. The Ministry of Labor is in charge, and the Department of Labor is under the Ministry of Labor and Employment. So the Department of Labor is directly involved in the implementation. But currently, we don't have a holistic national policy on occupational health. What we have are sectoral policies or regulations. For instance, we have occupational health and safety regulations for the mining sector, occupational health and safety for oil and gas sector. Currently, I think we have occupational health and safety for health. The Ghana Health Service also have their occupational health and safety policy. So we don't have a holistic national policy, but each sector has their policies. And for instance, we have the factory inspectorate division of the, which I don't know which ministry it belongs to. But we have the factory inspectorate division that goes around to inspect factories to ensure that conditions at the workplaces or in those factories are not injurious to the health of workers in those factories. So we have institutions, but it's not a unionized or unified policy, and so you don't have a one unit or one institution that regulates that.
There's something I've observed, and it's kind of a worrying trend. When you look at our filling stations or fuel stations, you realize that pump attendants have been very concerned about their dressing. Yes, they have a uniform. The footwear they use, the safety gears, I don't think they're supposed to use gloves because exposure to the floor, and then even either a face or a nose mask because they inhale it day in, day out. But you don't see any regulation. Every fuel station that you go, that is how the pump attendants dress. I tried doing the story about it some time ago, but when you go to the fuel station, none of them will allow you agree to speak on some of these things. Is this something that is concerning and should be considered serious?
So, as part of the establishment of filling stations, the they usually would ask for permission, or they write for permits to do that. The Environmental Protection Agency, EPA, will usually do what we call an environmental impact assessment of the project before it's even implemented. So when you want to open a filling station, you have to apply to EPA, and EPA will do an EIA, that's environmental impact assessment, before they either approve or disapprove of the thing. And so it's also part of their mandate to be doing checks to ensure that, because an EIA would result in a report, and the report will come with certain issues that uh, they think could affect the environment and human beings, which will be in the report, and they will require the owner of the filling station to implement. So it's the EPA's duty to also go around and check if whatever they recommended are being implemented by the filling stations or not. So if they are really doing their work, when they go for visits, they'll be able to see that by your workers are not. Because one of the institutions responsible for ensuring operational health, as I didn't mention, is EPA. Okay. They are part of it. So when they do their checks, they should be able to tell you about why are your workers not in their proper gear or dressed. So ensure that they do ABCD to protect their health. All those, for instance, at the filling station, we have a place they designate as a fire assembly point.
Yes.
All those things, when they come round to check, they will check all that to ensure that there's a fire assembly point when in case of any emergency, where the workers will run to save themselves. All those things, EPA is supposed to be doing that to ensure that they are protecting the workers and the environment.
I just feel like the supervision and regulation is very poor, because some of these things should be concerning.
Yeah.
I personally, just inhaling fuel, how troubling it is to you.
Yes.
And then someone who has to stay every day, stand on their
very
feet,
close to
the fuel, and they inhale it every day. I don't think it is really good for their health.
I'm very sure there are PPs approved for workers and settings like that to protect themselves.
Wow. Now let's look at some of the main challenges in enforcing occupational health and safety measures.
The major challenge is lack of unified policy or regulation. If we had a national policy on occupational health where we put all the sectoral policies together to form one body, and then we put a system in place for enforcement, we should be able to. So the first thing is the policy, and then followed by enforcement of the regulations. The policy and then the enforcement of the regulations, and then cooperation of all stakeholders is also very important. Especially we say that in occupational health, if there's no cooperation between the worker and the employer, occupational health will not run. Because look, no employer would want to have an occupational health system running in his place, because it comes with cost.
Yes.
It comes with cost. So in the occupational health policy, apart from having the regulations or the policy, the second thing is to put in place a system with a committee in charge of occupational health. All that comes with costs. If you are able to identify hazards and you need PPEs, you have to buy them. So the cost of it, most employers pretend that they are now aware of occupational health. Yes. Meanwhile, the International Labour Organization says that the health of workers and their immediate families is the responsibility of the employer. When you go to the workplace and you are exposed to a particular hazard that leads to a disease, you won't stay in the workplace forever. You will go home. Your family will be in danger. You live in a community.
Yes.
The community will also be in danger. So that's why the ILO actually summarizes and says that the health of workers and their families are the responsibility of the employer.
Unfortunately, this challenge or this canker runs across both private and then public sectors.
Yes.
So I think earlier this week, there was a fire outbreak somewhere in Accra or Kumasi, and then a fire officer who tried quenching the fire, he got stuck, and then because of the smoke, he was unconscious, and they had to walk him out of the place. So there were a lot of people asking. So imagine a whole fire officer going to fight fire without protective gear, because he should have been covered so that they don't inhale the smoke. or even have ways that they can use to be able to pass through the smoke and they won't get hurt. So I think government institutions have to um, enforce or regulate some of these things before the private sector will also learn from them. Let's look at the practical steps that employers can take to improve health and safety at their workplaces. Probably something intentional that they can do.
Yes, so the first thing is recognizing the fact that it's their responsibility to take care of the health and safety of their workers. If they agree to that, then next would be to put in place the measures, which is one, to establish an occupational health and safety system at the workplace, at least a policy on it, and then form a committee of both the people from the employer and the employees to manage that system of occupational health and safety, and be committed to implementing some of the things. Because one of the commitments could be to employ a safety officer. The safety officer knows, is a professional, so the officer knows all the hazards, potential hazards at the workplace, and how to prevent them. So it will be his work to be cautioning workers. Why are you climbing this height without your safety helmet? Put it on. Why are you working without your hand gloves? So if we are committed, we will put all this in place, and then the work will be done.
But I think regulation is so very important for our
Very, very important.
institutions.
Currently, we have a draft bill, a national bill on occupational health and safety, but it hasn't really gone anywhere. The bill is supposed to harmonize all other sectoral policies to form one national bill and include even sectors that are currently not part. We need a holistic national policy because there's no workplace in Ghana that doesn't have hazards to health work, to the workers. And so we should have that.
I think you the experts or those into this field will have to push it.
Yes.
So that and let's even get NPT in some of these committees to support so that it will be passed.
Yes, we tried forming a team to push this agenda. So currently we have the World Safety Organization has a branch in Ghana, and we are not only training people to become experts in the safety of workers or occupational health and safety, but we are also pushing. We are talking to stakeholders to see the need to fast track this policy on occupational health and safety and to ensure that government implements every aspect of it to ensure workers' health and safety. Worker unions also have a role to play.
Yes, yes.
When we go for negotiations of conditions of service, we usually concentrate more on the monetary aspects of our negotiation, forgetting about the health and safety component of our work. And if you even check some worker unions, we even want to convert the health and safety components into monetary terms to increase their salary.
Yes, yes.
So let's engage health and safety experts when we are negotiating conditions of service, so that with their expertise they will show us how we should demand for our own safety. It should not be a discretion of the employer to take care of you. It's your right and it's your employer's responsibility. So if there are laws and regulations, for implementing those laws and regulations will be the next thing to do to protect all of us.
I know it is quite difficult for an employer to always seek for your safety, because if your employee does not pay attention to you, probably yes, you have the choice to leave. But if you leave, what will you feed on? So people are always forced to work under some of these unsafe conditions.
And one thing employers should also know is that it's in your own interest to care for the health and safety of your worker, because if your worker has sound mind and good health and knows that you care for them, they will also be ready to put in their best for production to go up. Another benefit, it raises the image of the organization. If you have a company where every now and then accidents are going
happening
on,
with your staff.
people will be scared to even come and work and sacrifice for you. So it's the employer's own good to take care of the health and safety of their workers.
Very important. Now, we'll just be wrapping up on this, but I'd like to take a key message or advice that you'll be giving to employees and then even the employer on how they should prioritize their health and safety.
I'll say that we are now in the millennium world, and employees should know that safety starts with them.
Okay.
Safety starts with them. You should take your safety into your own hands. Because if you die today, your employer will replace you tomorrow.
Yes.
If you get injured, you may be replaced the next minute. So you should take your health and safety into your own hands and demand that the employer does his part of the bargain. The employer should also know that they always say prevention is better than cure, and cure is more costly than prevention. So the little amount or resources you spend preventing chaos and accidents at your workplace is far better than the cost of compensations and replacement of workers. Because if you replace a worker of 10 years experience today, you have to retrain the new worker you are bringing in. And that comes with another cost. Production would halt or even slow with a new worker because the person will still be trying to learn on the job. So the benefits of ensuring occupational health and safety far outweighs the cost of it. I urge both employers and employees to take occupational health very serious. It's an international regulation. The ILO set out, and all governments have subscribed to the ILO rules. So we should be implementing that in our own part of the world.
I think we have to push this campaign so that some of these bills will be passed into laws, and the regulation and enforcement have to be taken serious, because an employer might feel like, okay, if I lose an employee, I'll get someone to replace the person, and I think the regulation will kind of push them or force them to put some of these measures in place to protect their staff. And when we talk about the health and safety, let's on the mental health too. I think they need to get either counselors that will always um, counsel their staff, because there are a lot of people who are not mentally stable at their workplaces. Thank you very much, Doc. And that was Dr. Abdul Moist Kumar Mokhtar, PhD. He is an environmental health specialist and a lecturer at the School of Public Health at the University for Development Studies. And my name has been Moni Rubaria. Thank you very much for always watching us. Once again, like, comment, and share our content so it will reach a wider range of people to also benefit from it. And your contributions are very important. Thank you to the team. Bye.